Hi, and welcome to the Polka Dot Palace. My name is Kelly. We're a family of 4 DIY enthusiasts sharing our lives on YouTube from St. Thomas, Ontario, Canada, and today is Thursday, July 4th. But today, I'm not here to build a camper, play in the garden, or show you how to paint a counter. Today, I'm here to ask for your help. I am calling out the Ontario government and the Canadian government. For the last 10 years, I have actively been searching for a family doctor. I have been on the wait list for Ontario. I have not gotten one. I'm going to tell you a story of what happens over 5 years and a pandemic without a family doctor and the financial, mental, and physical health struggles that I am having to date. Doug Ford and Justin Trudeau, listen up. Things need to change. Before the pandemic, I owned a mechanic shop, was a bodybuilder, have 2 great kids. I've had 25 years in IT and management. Life is pretty good. The pandemic hit right after a divorce and the dissolution of my business. Needless to say, I was already in a dark place. I got a job, and right when the pandemic hit, I got laid off. I did everything I could to make ends meet. This is just to show you that this is not the current situation. This is not how it has always been. I have been looking for a family doctor for 10 years, and when I got sick in June of 2023 after being laid off and unemployed, I was told by the Canadian government that I need to repay CERB. They want me to repay $20,000 for having lost my business, lost my jobs, worked from home, taken underpaid positions, and health issues have ensued. After getting laid off, I started sending out resumes. I couldn't believe that I'd spent 3 years building a life with that company to suddenly have it ripped away, and I'd just gotten engaged. But I'd been having health problems since about fall of 2022. I'd been ignoring them. I didn't want to go to the walk-in because they generally won't help you with anything, and Emerge is not really an option with the pandemic going on. I didn't want those germs. So I'd take antacids and Gravol and try to cope. And it would come and go. When I got laid off, it got really bad, and I got into a lot of pain. My abdomen was killing me. I was throwing up multiple times a day, and I couldn't leave the house. So I reached out to one of the online doctors, and the lady was lovely. She referred me for a CT scan. Problem was, it was June, and the first available appointment wasn't until October. So that wasn't helping much because I was losing weight rapidly. I'd actually gained quite a bit of weight and was up to almost 150 pounds in about January of 2023, except for by June, I'd lost about 20 pounds of that. I was sitting at about 125, 130, and while I felt a lot thinner and much better about how I looked, I wasn't healthy. So come August, when by that point I couldn't leave the house. I couldn't go anywhere because I couldn't be more than 10 feet away from a toilet. I was throwing up multiple times a day. I was down to less than 120 pounds. I'm 5'8" and 45 years old. I went on a 3-day liquid diet just so that I could manage to go to Emerge to try and find out what was going on with me. When I got there, they were great. They ran a CT scan and found out that I had nodules on my intestine. Very scary thing to hear. They told me I should talk to my family doctor. But remember, I've been on a wait list for 10 years. So they gave me some antibiotics because I had a bit of an infection and sent me on my way. I didn't hear back from the GI doctor or have an appointment until December. By that point, I was down to about 110 pounds and I had 3 broken front teeth. I've managed to get the middle one fixed that needed a root canal, But seeing as I was on unemployment and severely financially in a pinch, I can't afford to keep a roof over our heads and get my teeth fixed. So we spent about $1,000 out of pocket in about March to get the root canal done on my teeth. I'm still in pain every day, and I'm hoping to get that fixed. Between the time when I saw the GI doctor and I had a colonoscopy and got a diagnosis of diverticulitis, irritable bowel syndrome, and acid reflux, I suffered. All of these doctors kept telling me to speak to my family doctor for care in between. I don't have one. I've been on a wait list for 10 years. It took over 10 months to diagnose me. In that time, I went from 150 pounds to 116 pounds currently. I have multiple broken teeth from the acid reflux, and I have no support. I have sent out, on average, 20 to 30 resumes a day for over 10 months. And the only offers I'm getting are for minimum wage jobs that want to utilize my 25 years of experience in management and IT and pay me nothing. I can't live off of that. And on top of it, the government thinks that I need to pay them back $20,000. I can barely keep the roof over our heads. I have been hustling. Side jobs, landscaping, painting, people's, friends, websites, you name it, for the last few months to try and make ends meet. I am exhausted. I am dizzy. I am sick. I am weak. If I get stressed out, all of the symptoms of those diseases that I'm dealing with get worse. The GI doctor won't talk to me about anything but the specifics of my gut health. He doesn't give me any ideas as to how to handle it with food. I've done all that research, and so far, nothing helps. Remember, I was a bodybuilder. I know about nutrition. I know about fitness. I know about being healthy. The reality of the matter is that the stress of this entire situation has definitely gotten to me. Over the last few months, my anxiety over our financial and my health situation has gotten desperate. I have tried dealing with it on my own. I still work out. I still do projects around the house. I try and keep a positive attitude. And if you've watched any of my other videos, I'm sure you didn't know what was going on. To those of you that comment about the broken teeth in a couple of them, thanks. I know why. I'm actually on YouTube with the hopes that someone will notice what I'm doing and this will go viral, because at this point, I'm desperate. About a week ago, the depression got really bad. I haven't been sleeping. I haven't been able to eat much because of my stomach issues and because of my teeth. Right now, I weigh 115 pounds. I couldn't handle any more. My fiance went with me and we went to the hospital. I needed help. Walking clinics in Ontario will not prescribe mental health medications. The only doctor is a family physician, but I don't have one, and I've been struggling for years now on my own. So I went to CMAJ. A lovely lady from CMAJ talked to me and was incredibly kind and compassionate. They offered me 3 one-hour sessions over the next few weeks in order to have counseling and help come up with a plan to cope. I voiced the fact that I really did not like psychiatric drugs and that I was very concerned about them, but that I knew I needed help. When the emergency doctor entered the room, he took one look at me and said, "I can't help you. I'm going to refer you to a psychiatric evaluation. It'll be a few weeks." I'm 115 pounds and 45 years old with broken teeth. I'm dizzy and tired. I haven't slept more than 10 hours in the last 3 days. I need help. But he acted like I was drug seeking. And while I understand that Ontario, and specifically St. Thomas, has an incredible drug problem, that's also on you, Doug Ford. My usual coping mechanisms: I meditate, do yoga. I've been taking St. John's wort natural remedy. It's not working. So right now, I am sick. I am still looking for work. Physically, I am not really able to work. I don't sleep. I still throw up. I'm losing weight and I can't eat. I had a breakdown and I reached out to 988. For anyone who doesn't know, 988 is a free service in all of Canada. It is available to every Canadian by either text or phone. 24/7, there is someone there that will listen. So far, it is the only service that has been any help to me in the last 5 years. I was in a really dark place, and they talked me off the ledge, and I will always be very appreciative. However, they pointed out that with all of my health issues, I really should be applying for Ontario disability. I don't really know anything about that, and nobody's mentioned it to me before. So they just suggested that I reach out to Elgin Legal Services, which is a community resource in this area that's supposed to give assistance for ODSP, unemployment, EI, landlord-tenant, and it's all supposed to be free. So after feeling a little better after our conversation, I decided that that was my action for the day. I was going to fill out the contact form. They called me the next day, and I was informed that yes, it sounds like I probably qualify for ODSP, but I can't apply without a family doctor. So at this point, I am sick, financially ruined, and I can't get help in any way without a family doctor. Yet I've been on a wait list for over 10 years. What do you want your citizens to do? You either need to make family health care available immediately, or you need to make mental health services available separately from Emerge and Family Health. This is ridiculous. I am not doing well. I am not functional. I owe taxes and backed money from CERB that I don't think that I owe you at all. And you have done nothing but raise taxes, raise inflation, and make healthcare more inaccessible. You need to do better. In 2024, it was reported that 2.5 million Ontarians are without healthcare, and that number is expected to double by 2026. Canadian-wide, millions are without access to primary care, mental health, and suicide rates are climbing. Yet access is still limited. I'm sorry for being emotional in these videos, but I'm struggling, and asking for help when you're at your lowest point is one of the hardest things you'll ever do. So I'm not sure how we turn this around. I don't know how I'm gonna get Dofo and JT's attention, but if you could help me by sharing this video and keeping the commentary going, I would really appreciate it. If you are struggling right now, I would highly suggest reaching out to 988. It is a free service for all Canadians. There is someone available 24/7. You can call, you can text, or they're available through their website at 988.ca. I would also strongly suggest that if you have the means, donate to the Canadian Mental Health Association. There'll be a link in the description below. There is also a current petition going at change.org. Many people are suffering with these issues. Guys, this channel is not going to become a sad sop of a channel. But if I can use this platform to raise awareness as to what is really going on in Canadian healthcare, then I will. The whole world thinks that we have universal healthcare. We have an exact opposite of that. We have a lack of healthcare. Thank you so much. If you have made it all this way, please give me an emoji or something in the comments so that I know someone's listening. If you could share this video, I would appreciate it. Together, I think we can maybe push for some changes.